An encouraging sign in the fight against COVID-19. Fewer people are currently in the hospital being treated for the virus. Jonathan Polasic spoke with a doctor appointed on Governor Abbott's strike force who says hospitals are more prepared now than they were 5 months ago.
Good evening, Tatum. We talked about hospital capacity around the state and how they've responded to the ongoing COVID pandemic. And Dr. Zerwas told me that hospitals have actually responded pretty well to this point.
The hospitals have actually responded incredibly well. I think we can be very proud of the healthcare system that exists in the state of Texas to be able to absorb the impact of this pandemic. We certainly were incredibly busy just 2 or 3 weeks ago.
Midland and Odessa still have an above average number of patients in ICU at around 43%, but it's slowly going down.
Those numbers were a lot higher in the Midland Odessa area, and so we're pleased to see that come under better control and really a better opportunity to be able to treat all the patients.
Why do you think that Midland Odessa, they've kind of seen a little bit of a downturn or a downshift in the number of total patients coming in, whether it be for COVID or general need?
Yeah, the primary reason that we're seeing patients see it come down is because citizens of Texas have really taken the admonition that the governor made pre-4th of July to say, look, we all have the ability to rein this thing in, and that's going to be through wearing a mask, distancing ourselves, hand hygiene, and avoiding the congregate settings.
Dr. Zerwas also said that he believes hospitals are more prepared now to deal with patients as they come in because of what they've experienced these last few months.
Most of what we're doing to treat patients are based on learnings and experiences that we've had in earlier weeks and months, or perhaps even things that we observed in the Northeast that were things that we determined were better to treat the patients and so forth.
One of the concerns Dr. Zerwas has relates to school and holidays. He says that we need to continue to practice these mitigating behaviors even when we head back to school or travel, because that will be the thing that keeps us safe until a vaccine or some other type of treatment becomes available. Tatum?